Okay. Hello. Good to see you guys. I wanted to give you some information that's from Memorial Mission, and then I'll tell you about what's going on with my daughter. Can I approach?
Sure.
These are papers from the pharmacist in Memorial Mission, ordered by the director of the mission after I was done talking to the director of mission. And then I'll go over those in a second, but what I'll tell you is last Tuesday, I saw you guys Monday, and then last Tuesday is when my daughter actually went in for her chemotherapy. Well, the day that we went in, I was asking for the CAM program that I've informed you guys about, plus the other information, the cannabinoids for my daughter. The doctor didn't agree with it when we went to where we had Ariel's port accessed. So we went to the hospital. He was saying that he was going to do 3 nauseating medicines for my daughter when we were actually just wanting 1 nauseating medicine for her. Well, because of fear and different things like that, they didn't actually give the medicine that we were asking for. So Tuesday night, when they were getting ready to do her chemotherapy, they started injecting her with the 3 nauseating medicines. The 1 nauseating medicine made her flush. She had an allergic reaction, and she stopped breathing. She couldn't breathe. So let that go. They stopped. They couldn't do the chemo that night. So the next morning, when we wake up, we get a call. They're going to try giving her the medicine again, and we says, no, we don't want that medicine for her. We wanted to talk to the director of the hospital because of the programs. We'll come to find out, because we had asked for the legal cannabinoids for my daughter, because of fear and everything, the doctor reported us to Child Protective Services. So besides of us going through the chemotherapy, we had the Child Protective Services called on us because we were asking for a legal substance for our child. So that's where I'll go over the papers that you have. And on the very first page is the dronabinol, which is the actual legal cannabinoid Marinol that is for nauseating and vomiting. As you can see, there's approximately 33 adverse reactions to it. So, and they're at percentages, plus or minus, or greater than or less than 1%, if you look at those. Then if you go to the second page, this is only one of the nauseating medicines, not 3. This is just the one that she had the adverse reaction. You can see there's 102 adverse reactions. So this is where we were asking for something that was actually better for our child because of the adverse reactions, yet because of fear and anxiety from the doctor thinking sanctions or whatever was going to be taken against him, he preferred not to prescribe the Marinol. But after we talked to the director and after we talked to Child Protective Services, my daughter is now on Marinol. She has had a great turnout, a great outcome from the Marinol because of all the other adverse reactions. And the very last page is the actual program, the CAM program that we were asking for into it. And so that's where I want to get to. This is a statement now that I have from the North Carolina Medical Board. It was on their meeting minutes in 2013, and it's their current position statement. And this is what it says. You can go back there. It's policy for the use of substances, controlled substance for treatment of pain. The North Carolina Medical Board recognizes that principles of quality medical practice dictate that the people of the state of North Carolina have access to the appropriate and effective pain relief. The board recognizes that controlled substance, including opiates, which that ain't the Marinol, may be essential in the treatment of acute pain due to trauma, surgery, or chronic pain, whether due to cancer or non-cancer. And it says the diagnosis and treatment of pain is integral to the practice of medicine. The board encourages physicians to view pain management as part of quality medical practice for all patients with pain. It is especially urgent for patients who experience pain as a result of terminal illness. Now here comes the part that is pretty much pertains to what I'm talking about. This is in their meeting minutes. Inappropriate pain treatment may result from a physician's lack of knowledge about the pain management. Fears of investigation or sanction by federal, state, or local agencies may also result in inappropriate treatment of pain. And that's what has happened to my daughter, was that the fears of sanctions and stuff was the inappropriate change. And then it says appropriate pain management is the treating physician's responsibility. So even though it was the treating physician's responsibility, because of the fear of sanctions and everything, that's why he did not do the actual nauseating medicine or the program that we asked for. So, and that's where it comes to the resolutions that I had presented for the agenda. None of those were illegal. It was complete legal. The cannabinoids and then the CAM program, both resolutions. But now I understand because of fear or thinking that an issue might arise, that's why my resolutions weren't put on the agenda or whatever. But that's just how it goes. I mean, people need to be educated on where the actual benefits are, even if it is out of their knowledge or whatever. That's where I just want you guys to understand. I'm not here to cause problems. I'm not here to make you guys look like idiots. I'm here to educate you and show you actually that there is things that can help people. But because of people being in fear in the United States, not from a terrorist, just in fear of what can happen to them for prescribing something just because of the name or the association that it has with it. Okay? Thank you very much. That's what she's on now. And that's the dronabinol.
Oh,
that's just the name.
That's
yeah.
the first page.
Yeah, that's the actual name of it.
Gotcha.
And she had the actual true dronabinol in the hospital, but the prescription that we got for her to take home is the actual generic kind. It's like a gel tablet. And what it is it's 100% THC in it, which THC is a cannabinoid. There's so many different cannabinoids in there. But it's mixed with sesame seed oil. So it's not actually mixed with anything else, but that's just by itself. But that's just where, you can see, and that's where 102 adverse reaction is only one of the nauseating medicines. I didn't get the other two nauseating medicines. So just to show you the difference, that this at a small percentage, greater than or less than 1%, is small compared to where you look at these and they don't even have a greater or less than 1%.
Who ended up prescribing the Marinol?
The doctors. See, we had to talk to them.
Different doctors.
No, the same doctor.
Same one.
Yeah, but we had to go through the director of Memorial Mission. Because after the Child Protective Services and everything were called on us, we went and showed them all the legal paperwork and everything. It wasn't like we were going in there and asking for a legal substance. We were actually asking through legal process for something that was better for my child. But that's just how it goes. I mean, and that's where people just need to get educated and sort of understand. And that's the same thing with the resolutions. I wasn't in here to try and push something illegal or make you guys feel like that you're supporting something illegal. Everything on those resolutions were total legal things on there. And all I was asking was, we've got to support the doctors, because if the doctors stand there and can't actually prescribe what's needed because of fear, then they're not doing their actual stance that they should do. Okay? Thank you very much.
You and others have been consistent in trying to educate and teach, but it seems to me, instead of being a local issue, it's a state issue. And through statute or whatever, the state would tell us how it's going to be. And what efforts are going on at the state? It seems like if the state would bring it up.
Well, there's been 3 medical bills that have been presented over the last quite a few years, I think 6 to 8 years, but every one of them has been set to the side. They haven't been reviewed or anything, but it's just like how people just judge it. I mean, it gets put to the side before it's even reviewed. I'm going Wednesday to the North Carolina Medical Board, and I'm going to be talking at the policy committee down there in Raleigh, because they're one of the persons that has control over reviewing, rescheduling controlled substances. And I'm going to pretty much tell them what had happened to my child at Memorial Mission from this situation itself. How, we went in there asking for something and we didn't get the appropriate things for my child. And to stand there that night and actually see my child not be able to breathe right in front of me is a lot. And then for me to go the whole night, I had to come back home, and I wandered and wandered. I only got maybe 1 hour of sleep. And then to go back, eat breakfast with my daughter, take a nap with her, and be woke up by Carrie saying that CPS was coming up there. So besides all the trauma that we had, that was another trauma that was added on to us just because of us speaking the truth. I mean, it wasn't nothing. I mean, that's just something. My family's been through a lot, and we're going to keep going through it because we're a strong family, and my daughter's very strong, and she's doing very good. And the Marinol, it's just prescribed for 2 to 3 days afterwards. It's not an extended period of it, which we don't want her to be on extended period of it.
Your knowledge of it gave you the ability to request it. A lay person like myself would have never known about it. But if I understand you correctly, this is a legal medical drug that can be prescribed.
Yes.
But a doctor isn't willing to prescribe a legal medical drug. It must be that the medical protocol is that you don't give people this.
No, it's just the thought of what they're actually prescribing, and especially to a teenager. Do you see what I'm saying? But that's where it shouldn't matter how old the child is or who it is. They need to really look at the adverse reactions. Look at the science behind it and see what is actually better for the child or for the adult, either or. But just because of the being scared of it, they've got to do what they feel. Yeah, yeah. So, which I completely understand, because they don't want to lose their license. A doctor could lose their license. But when the North Carolina...
If it's a legal drug, why would he lose his license?
Well, that's just the way that it is. They think that they could lose their license. They think they could lose their license. Do you see what I'm saying? But that's where, when I went to the medical board and looked in their policy thing for in the September meeting minutes, that's where I saw their stance on controlled substance. And that's what I'm going to be going down and talking to the North Carolina Medical Board this Wednesday down in Raleigh.
I think in the long run, you might get faster action trying to get a referendum, let the voters vote on it statewide.
Yeah.
Trying to convince individual legislators, I think, is going to be tough.
Yeah, it is, and that's why the last 3 bills have just pretty much sat to the side. I mean, nobody really wants to review it because they just have it in their head that this is a demon drug, and it's not anymore. There's so many benefits to it. I mean, just by seeing the paperwork that's from a pharmacist, you can actually see yourself. And I mean, if I was going in there, I would much rather have 33 adverse reactions than 102, and that's just one of the medicines. So probably there could be up to 300 if you look at the other 2 medicines that they were giving her too. So I would much rather have that percentage of adverse reactions than the others.
So how is she doing with this medication?
Real good. I mean, there's been 2 or 3 times she's gotten sick, but that is, they say, there's another medicine she's taking. It's Kytrol. There's a couple different medicines that she's having to take, antibiotics and that, which she's only allowed 2 certain antibiotics, but they were trying to feed her some other antibiotics too. So she's had reactions to those too, but the actual nauseating thing, they say that they just can't believe that she's only gotten sick the 1 or 2 times.
And the nauseation is just a byproduct
of the chemotherapy, And they don't want her actually vomiting right now because of after her surgery down here,
Yeah,
because of,
stress on it.
yeah, it could hurt the inside and really hurt what is actually the surgery that she's had gone through.
Well, thank you.
Well, thank you for the time. I really appreciate it.